Hi, my name is Doug Gray. I'm a surgeon at Kaiser Permanente.
Hi, and I'm Bill Schechter. I'm his sidekick, and I'm a surgeon at San Francisco General Hospital. We're sorry we can't be with you tonight. Doug's halfway across the country, and I'm actually halfway around the world in Jerusalem right now. But we just wanted to express our sincere thanks and humility on being a co-recipients of this award with our friend Paul Hoffman. Doug?
And we know Paul Hoffman's there. We thought we would just spend a few minutes telling how we got to where we are today with Operation Access.
Yeah, so Doug, how did this whole thing start?
Operation Access came out of a very productive discussion after an American College of Surgeons meeting where I had never met Bill, Bill had never met me. We were talking about the inequalities of surgical care and how people without insurance had no access to getting a surgeon.
Yeah, so we decided to meet weekly, and our first rudimentary business plan was written on a napkin at Mel's Diner on Geary Street. Then we found Paul Hoffman, and he turned this into a professional operation.
Paul generally asked us, would you be offended if I wrote a business plan for you? And we said, oh my gosh, we finally found someone who knows what he's doing.
And you know, we started from meetings in Mel's Diner, and now we've progressed to doing 8,000 cases and what was it, $100 million worth of surgery, and it's just been an incredible journey.
And one of the most gratifying elements of Operation Access is there's no question that it benefits the patients that don't have insurance, but it also benefits the volunteers. And as I've said many times, if you were to watch two people walking out of a hospital, one of whom had surgery and one of whom gave up his or her Saturday or a weekday to do the surgery for free, you'd be very challenged to tell the difference because they both get a lot out of the program.
And I just want to say that I know I speak for Paul and Doug as well, that we have such respect for the leadership and staff of Operation Access, and also for the volunteer nurses and doctors. And without all of their effort, none of this would have happened.
And I'd like likewise to recognize the hospitals because they took an asset that wasn't being used much on the weekend, realized that it could be used for community benefits and really betterment of those people living around the hospital, and actually turned something that was very unproductive into a real jewel in healthcare. The hospitals in California and the Bay Area in particular have really stepped up their game to really try to deal with those who are uninsured or underinsured. We'd really like to take this opportunity to be both honored and humbled in this recognition by the Albert Schweitzer Fellowship and become leaders in that organization. It's a group that I think Bill and I both looked at of the previous recipients, and we were humbled in many ways about the good work that they were doing, the intent of the organization, and again, thrilled to join and be a part of that honor.
Thank you very much.